But the bigger issue that we've been really honing in on for the last 6 or 7 months, and I'm sure anyone in the behavioral health world already has their ears perked up to this, is data sharing laws. HIPAA, 42 CFR, Michigan Mental Health Code, HIPAA being Health Insurance Portability Accountability Act. You know, a lot of these legislation in place to protect the names of individuals who want to seek treatment, that want to avoid the stigma. And, you know, for many good reasons. But unfortunately, these days, these laws are not well understood, even in the treatment world. So there's even research showing that's coming out, most err on the side of caution and overly restrict access to care and to this identifiable data when they don't need to. And I understand that there's an importance of confidentiality here, but if we're not making these treatment connections, then we're ending up in our system where the treatment provider, recovery coach providers don't know that overdoses are happening. We don't know about this high risk of subsequent overdose. And we're left, you know, turning the wheel of emergency response without getting a more sustainable and really effective system in place. So without really digging into the laws and learning about what's possible, sending identifiable information, we're really limiting our opportunities for case coordination that can save lives. So really, I want to talk about the laws we've learned. This is a section where it can get pretty dry, I admit. But this recent ruling, we worked with the EMS legal representation from both Life EMS in Kent County and Monroe Community Ambulance in Monroe County. And they both agreed that the laws I'm about to highlight today allow direct referrals from EMS agencies to a recovery coach and treatment providers without collecting consent on the scene. Now, the collect consent on the scene is pretty important right here. We even tried for a couple of months up in Kent County where EMTs would try to get releases of information to collect on the scene. You know, if someone's just been revived from an overdose, you know, they may not have the wherewithal to make those kind of decisions. We know that substance use disorder can impair judgment on the scene. And, you know, if you're just being revived in an overdose, you're probably not likely to want to sign something on the scene. So we tried the route before we really understood the legal ramifications of it. And trying to collect consent on the scene was not feasible. So we dug into the laws a little more and we found out that yes, we can send these referrals without collecting consent. So under here, under the EMS, we highlighted the laws at play here. You'll note that HIPAA and Michigan Mental Health Code, the EMS has to abide by, but 42 CFR Part 2 is not one of these laws. So 42 CFR Part 2, for those who don't know, are a stricter federal law about patient identifiable information for substance use treatment agencies. And the reason they don't apply to EMS is that EMS agencies are not federally assisted, nor do they hold themselves out as behavioral health treatment providers or substance use treatment providers. So, and you would have to be both of those things for 42 CFR Part 2 to apply. So EMS only has to abide by HIPAA and Michigan Mental Health Code to send it to either CMH or a provider organization. And so here are the laws here. CMH agencies have an extra layer of legal protection in that they're a public health authority for the purpose of preventing injury. So especially in the case of COVID, where we're trying to do contact tracing, we kind of need to know the names to prevent further injuries. Similar reasoning for opioid injury. You're allowed to send the names to a public health authority for the purpose of preventing injury. But even more basic than that, for the purpose of treatment activities of a healthcare provider, you know, or in Michigan Mental Health Code, there's another law on the books there, to a mental health or public agency on a compelling need based on a substantial probability of harm. So I've talked a lot about how that initial overdose, you're at much higher risk of encountering a second, 15 to 24 times higher risk of death. I would say that's a compelling need based on a substantial probability of harm. So under HIPAA and Michigan Mental Health Code, EMS agencies can send information to CMH. And even a provider too. These are the same laws as over here. They don't have that extra layer of protection for the public health authority, but they're the referral can still take place with the names without consent. So again, for the purpose of treatment providers, treatment activities of a healthcare provider, and on a compelling need based on substantial probability of harm. So for example, if I, Leonard Swanson, encounter an overdose and EMS agencies have that treatment record of my phone number, my contact information, address, they're allowed to send that to either the CMH or a provider like the Grand Rapids Red Project. If the purpose is they can do a follow-up service. And of course, us as researchers, we're allowed to collect the identifiable information for research, audit, and evaluation purposes. So why am I stressing EMS referrals so much? Well, the EMS agencies reverse a lot more naloxone administrations than law enforcement or fire alone. So when we started out this program in Monroe County, they were only receiving referrals from the Monroe County Sheriff's Office while we were trying to figure out the legal pieces. And you can see this yellow line, maybe one referral a month, maybe two referrals a month.